Corla to join with other deputies in offering our condolences to all the families bereaved and to our full support to the frontline workers. I just want to address a couple of other issues that may not have been addressed. Corla, as the emergency rolls on and people live out this pattern of a new normal, we are aware that despite the creativity and humour engendered by social distancing, that this pandemic has the potential to take its toll on our collective psyche, on our mental health, well-being and resilience. The pressure keg of self-isolation and partial lockdown on the average household can be immense. Add to the mix women and families in domestic violence, travelling people on halting sites, people in direct provision, homelessness or simply alone with no one to talk to and being in that vulnerable age or health category. I reiterate the calls from my colleague Roger O'Gorman for increased resources to domestic violence services such as Women's Aid, rape crisis centres, to Women's Refuge, and welcome the announcement from An Garda Síochána yesterday that their members will place specific focus on families and individuals living in domestic violence during this period. For those in the trenches, on the front line of the battle, we cannot imagine the incredible strain that people are feeling as they deal with the daily intake of those who fall into coronavirus, knowing too that they are at high risk of infection. That they may face the prospect of going home not being able to hug loved ones. It is important, Corla, that a full complement of supports are in place right across our health system to both debrief staff as they come off shifts, but also that they have access to online counselling, peer support and other support services if they need them. In asking for this, I would include all staff working in our hospital settings, Section 39 providers, nursing homes and other settings. It is my understanding that access to such services is very limited when you consider that healthcare workers are trying to manage childminding, homeschooling, maintaining their own family's health through this crisis. The Occupational Health Department are completely immersed in logging, reporting and directing staff towards isolation who are displaying COVID symptoms, and that previously offered counselling and support services are not accessible. I think that a dedicated service, accessible 24/7, would be vital to the mental health of our workers. For workers on other front lines, retail, pharmacies, delivery and postal services, could I appeal, Corla, that employers would ensure that they check in on their staff regularly and that they ensure that procedures are in place to keep staff safe, because they are dealing with very worried and distressed people. Corla, my colleague Councillor Maria Dollard wrote to Minister Harris earlier this week regarding the plight of Section 39 care providers and our nursing homes. We note with concern the emergence of clusters of COVID in such settings, and I appeal to Minister Harris to ensure that all services for people with disabilities, intellectual disabilities, older people and other care settings, both day and residential, are afforded the same access to PPE and hand sanitisation facilities as the public system. Anomalies that exist in terms of pay parity between Section 38 and 39 providers must be addressed as a matter of urgency, as must the differential cost of care between public and private nursing homes. Section 39 providers have been left high and dry by successive governments through pay inequality and funding cuts, a situation made more acute by the imposition of efficiency measures in recent years, leading to a point where they are begging for basic supplies of PPE. Yet these organisations are providing an exceptional level of care beyond a basic social care model for their service users. Two final points, Corla. The first on bereavement support. Families grieving loss of a loved one through COVID or an unrelated cause of death are being dealt a double blow of not being in a position to properly come to terms with their loss. It is often held that the Irish way of saying goodbye is culturally among the most empathetic and comforting in the world. Families are denied that comfort due to the necessary restrictions imposed on funeral services for the duration of the health phase of this crisis. For many, that denial delays and holds back the grieving process, the ability to come to terms with or celebrate the life of a loved one. I am sure there are similar services to the one in my own constituency, the Kilkenny Bereavement Support, who are giving voice to those who are silently grieving. Ours is an exceptionally professional but entirely voluntary service, and it is important that bereavement support, counselling, suicide prevention and mental health charitable services are supported by the state at a time when the opportunity for voluntary fundraising has largely dried up. Could I finally ask that we receive some clarity from the HSE and Government on the issue of masks for the general population as a means of reducing infection? A number of weeks ago, a group of people in Kilkenny began making homemade masks from a template found online and using simple materials. The HSE issued a statement saying that masks were not effective in reducing infection, yet evidence from Thailand and Vietnam, where it is probably culturally more acceptable, showed that masks did have an impact. Masks are now mandatory in Austria, in Czech Republic, and the Cuban government has recommended people make them at home. People have lots of time on their hands. I see the ICA, Irish Country Women's Association, are starting to make them. And with a widely circulated template, we could go into mass production of homemade masks. I would welcome clarity on this issue. I would like to thank our Health Minister, Simon Harris, and the Government for their ongoing work into leading us through this crisis, the cooperation and collaboration of all parties and independents in this House. And in particular, I would like to wish Dr Tony Holan a speedy recovery. I think there was a collective sigh of relief across the country when it was found that he was back at his desk again this morning. So we do welcome that. Míle buíochas, Can Corla.
Costello, you're sharing.